Welcome for another special video. Again, this is Dr. Chris, your online family doctor, making medicine easy for you to have a healthy life. Medyo dumadami na rin mga cases ng chronic kidney disease sa kabataan. And recently, may na-encounter akong video that is pertaining about the rise of CKD, especially sa mga kabataan. Now, I'm not quite sure if this is already updated. Ano ba? Anong year ba to? 4 months ago. So, just recently lang siya nilabas. And this is from GMA Public Affairs. Hopefully, okay lang naman panoorin natin to. Dahil natin sa mga important parts because, well, kidney problems are already rampant, specifically sa ating younger population. Now, so this is a quick overview and rundown kung ano ba yung nakikita natin currently sa stand natin on chronic kidney disease. Okay, this is a special report by
Si Dodi, sa sobrang hilig sa chichirya, umabot sa puntong inuulam na niya ito.
So, well, pag chichirya tapos inuulam, that's kind of odd and unusual. But taking into consideration na ang chichirya is high in salt, and salt really is should be regulated. And if you have abnormal amounts of salt, pwedeng magkaroon ng problem sa pag-regulate ng blood pressure. And if you have problem in regulating your blood pressure, your kidneys will cry. Okay, kasi you have to regulate your blood pressure correctly in order for your kidneys, okay, to function also correctly in filtering, okay, waste in the long run.
School, puro chichirya, umaga, tanghali.
Ang kanya naman
Kita ko yung chichirya parang parang mas magandang, wait lang, ayusin ko yung video nito, yung source ng video ko kasi baliktad yung tingin ko. Nakatingin sa kabila pero dapat mas magandang tingnan ko siya sa other side, no? Kasi para magmukhang titignan ko yung side na to pero dapat andun ako nakatingin. Kaya naman yan sa OBS. Flip, where's flip? Flip. Saan ang flip? Transform. Flip. Vertically. Oops, wrong. Ano ba yan? Mali. Flip. Vertically balik. Flip horizontally dapat pala. Sorry. Horizontally. Yan. Okay. Parang nakatingin ako dito. Balik tayo. Patalastas lang yan. Panorin natin ulit. Si Todi. Todi ata pangalan.
man daw paboritong panulak, soft drinks.
Hindi na ako uminom tubig.
So, soft drinks or soda, it's a high sugary sweetened beverage. Paired it with junk food like chichirya. It's a recipe for disaster na pwedeng makasira ng iyong kidneys. Okay? Taking to consideration na yung bata is around 20 years old. Diyan nagsimula yung lifestyle niya. Type of diet is not that much healthy. It might lead to something worse in the future. Okay, so medyo puyat siya dito.
Eto na si Dodi ngayon.
Okay. So, based on the image of Todi on the documentary, if you could see, there is a sudden, shift of fat, degradation. Nawala na yung taba sa kanyang braso. Sa pictures na pinakita kanina, you would notice na medyo even out yung fat distribution. There is distribution of fat sa may face. Pero based on sa pagsasalita niya, I think there's something else wrong. And then also, look at the arms. Ito, there is what we call an AV fistula. So, an AV fistula is the access para undergo ka ng hemodialysis. You have an inflow and outflow injection para i-attach sa dialyzer. And the fistula is also important para lumaki siya at mas mabilis magkaroon ka ng blood flow dun sa area. Technically, you have to undergo a surgery or surgical operation to create an AVF or an atrioventricular fistula. And then, after a month, saka mo pa siya magagamit. Kung wala naman tayong fistula, nag-a-attach sila ng catheter. Either the jugular vein or somewhere else. Either sa inguinal, pwede rin sila maging source of access. So, pag okay na yung at hinog na yung fistula, dun na sila mag-attach ng hemodialyzer or hemodialysis machine, and then tatanggalin na nila yung catheter.
May parang
See?
maliit na ahas na
Ayan. So, if you notice dito, yung mga fistulas, there is an enlargement ng vessels. Okay, those vessels are meant to be enlarged para lang magkaroon ng easy access, but there's also some complications. Lumalaki siya to the point na ganito kalaki, parang sobrang grossly disfiguring. Okay? Ang kahalagaan ng fistula para masabing patent siya, merong murmur. Okay, kapag pinakinggan mo siya sa stethoscope, meron ka marinig na hush or hum sa loob, meaning gumagana yung fistula.
pulupot sa ilalim ng kanyang balat. Kulubot na at
Okay, those are
naninigas pa.
scars from your
Pero hindi
hemodialysis
raw ito
procedures.
bukol, kundi lumobong ugat.
Yan. So,
Ang tawag
very
dito,
evident ang AVF. Yan, AVF sabi nila.
AVF o arteriovenous
Venous fistula.
fistula. Dito raw dumadaan ang dugo sa tuwing siya idinadialysis.
See, that's your dialysis machine, that's your patient, and then there are two attachments in sa area na yan. It's important to see, mention naman niya may access na blood going out of the body and then there's blood going in towards the body. So at this young age na nakakapag-experience ito, it's pretty much surreal, and wag na sana madagdagan yung mga ganitong situations kasi bata pa to. They're experiencing these types of procedures that are normally nakikita yan sa mga elderly patients na nagkakaroon na ng problem sa kidneys. So, nakapanghinayang, no? Because of a poor diet and poor choices of what you eat, okay, and what we consume. Dapat, if ever you are still consuming those types of food, mag-isip-isip na kayo.
Si Dodi kasi, sa edad na 20 anyos lang, na-diagnose na ng CKD o Chronic Kidney Disease. Ang itinuturong dahilan, ang labis niyang pagkain ng junk food at ng
Eating those types of ultra-processed foods as well as those unhealthy options, they can impose a lot of harm sa iyong katawan in the long run. Now, in this situation, bata pa kasi si Dondi and na-expose siya sa mga ganito. Okay, ganitong sitwasyon, it's pretty evident na it might have increased the risk of developing the kidney failure earlier. Okay? Kung iyan yung panay-panay niyang ginawa niyang tubig, ang soda,
nang ginawa na niyang tubig, ang soft drinks. At hindi siya nag-iisa. Bakit
Okay.
nga ba parami
Pag napansin nyo sa plato ng pinakita, hamburger, you have, ano ba yan?
ng parami at pabata ng
Oh, you have hot dog, bacon. Those are ultra-processed foods, okay? Tocino, pancit canton. I assume this one is beer, okay? Ano yung milk tea ng beer? Yeah, those are very unhealthy types of foods that can also fry your kidneys or sisirain yung kidneys mo in the long run.
pabata ang mga tinatamaan ng sakit sa bato. Ikaw, nakabubuti
Okay? This is here in the north. So most likely sa amin dito sa region, car kasi ang apayaw. Sa amin, nating dumaan siya sa Tuigaraw. Doon siya nagpa-check up. Ano pa? Yeah. In this one, di ba sabi ko kanina there's what we call dialysis, hemodialysis. In this situation, nagkakaroon ka ng build-up ng fluids sa sikmura or sa tiyan. So we call it ascites, and most of the time, pag ganito, you have to also drain that. You have to do what we call peritoneal dialysis as well para lang ma-lessen yung toxin sa katawan. Kasi the peritoneal fluid or the acidic fluid is also going increasing in volume kumbaga in these situations, and it can cause fluid overload. Okay, so kailangan ma-address yan agad. Another option is yan, hemodialysis. Sakit, diba? Yeah. So doing this, usually our patients na nag-undergo ng hemodialysis, they do this 3 times a week. Isipin mo, 3 beses sa isang linggo ka na-experience yung sakit ng pagdadialysis, di ba? And yes, this is your peritoneal dialysis.
Dialysis na mas madalas namin.
Hindi na pinakita. Ayan. So, the thing is, you have to be more aware of your choices. Kung ayaw mo umabot sa ganitong situations, learn from what Dondi has or still currently is experiencing. No, end-stage renal disease is not for everyone. Okay, and you don't want to experience this in your lifetime. Okay, if you have the options to change your lifestyle as early as now, stop drinking, avoid ultra-processed foods, avoid eating too much sugary, sweetened products or beverages, and at the same time, magtanggal ka ng bisyo. Panigarilyo, tanggalin din ang panginginom ng alak. No? Number 1 yon. Lalo na sa mga kabataan na medyo tinisip nilang cool ang pag-inom ng alak. No. Now, another thing is if you have diabetes or hypertension, please do control them. Because if you don't control those comorbidities, chances are your kidneys will also fail. Because it is crucial for your kidneys to control your blood pressure. Okay, if your blood pressure is not controlled, your kidneys will also not function properly. And if it will not function properly, it will not function in regulating salt, and it will not function in regulating your blood pressure. So it's a vicious cycle. So I think yun lang naman ang gusto kong i-impart dito. I don't want to provide a more lengthy detail about this video, and sana it's an awareness for CKDs in young individuals. Sana wag natin baliwalain ang rising number. And yes, tumataas ng number of cases sa Pilipinas, and we see also patients that are having acute renal injuries left and right, lalo na sa government hospitals. So it's important that we don't increase that count in the next future. Again, this is Doc Chris, your online family doctor. If you have any questions, please drop sa comments, give a like, subscribe sa channel, and see you in the next video. Peace. And paano mag-out? Bye.